Digestion. It's the pancreas.
Despite its small size, the pancreas has a huge impact on your health, especially when it comes to digestion and regulating blood sugar levels. Barbara O'Neill, a well-known natural health educator, delves into the essential role of the pancreas and its connection to common health issues, particularly diabetes. She highlights how our daily habits can either support or damage this crucial organ, offering practical advice that everyone should know.
Starch digestion is put on hold because we're now in an acid stomach.
The pancreas is found behind the stomach and has two purposes. It's one of the vital organs because it benefits in digestion by synthesizing enzymes that assist in breaking down the foods. Secondly, it is involved in the control of body glucose concentration by production of hormones such as insulin. These two functions are important in ensuring that one remains healthy, particularly in elderly persons. In the case the pancreas does not work properly, there most probably will be any health problems involving diabetes, pancreatitis, and even pancreatic cancer. Care for the pancreas is the most important. O'Neill states that this organ can be preserved with the help of a healthy diet, physical activity, and regular examinations. It is the function of the pancreas to control blood glucose levels via insulin secretion. Insulin is a hormone that allows the body to use glucose to fuel. After a person eats food, especially one rich in carbohydrates, it is converted into glucose, which circulates in the blood. The pancreas also makes insulin, which assists in moving the sugar from the blood to the body cells. When the energy is inside the cell, it can be used immediately or energy might be saved to be used later. However, when there is a lack of insulin in the system or insensitivity of the body cells, which is caused by resistance to insulin, then there is excessive glucose in the blood resulting in diabetes. O'Neill adds that while most people realize that it is sugar that causes diabetes, many are not aware that sugar is only one of the many reasons. Foods which are rich in processed and refined carbohydrates, unhealthy oils, and chips also challenge the pancreas and the body's ability to respond to insulin. In addition to that inactivity, too much stress and lack of adequate rest are a few of the other factors that can hinder the body from effectively using glucose.
Blood sugar by getting glucose into your cells where it can be used for energy.
While addressing several issues in her lecture, one important point O'Neill stresses is the factor of insulin resistance. It is the coordination where insulin can no longer be utilized by the body's cells. In other words, insulin functions like a key that opens the gate of any cell and allows glucose to infiltrate that cell. In a state of insulin resistance, the same key does not work anymore, and consequently, glucose is unable to move into the cell but remains in circulation. The cells feel that blood sugar is still too high, and as a result sends a message to the pancreas for more insulin to be produced. With time, this high demand for insulin on the pancreas makes the organ work harder than their limit and lead to exhaustion.
I'm sick of the sight of your insulin. An insulin resistance sets up.
The pancreas reaches a stage where it cannot produce enough insulin anymore to satisfy the body's demand, which is how a person develops type 2 diabetes. At this stage, an individual is no longer able to control blood sugar levels, and there are possible long-term effects such as heart disease, kidney failure, damage to nervous systems, and even loss of sight.
On the other hand, glucagon does the opposite. It raises blood sugar when it gets too low by signaling your liver to release stored glucose.
In her lecture, one of the key things that O'Neill centers upon is the contribution of fat into the process of digestion and overall health of the pancreas. It is the pancreas that produces the enzymes such as the pancreatic lipase, which are effective in enabling the breakdown of fat during digestion. However, the pancreas is affected differently by the various types of fats. For example, favorable fats, such as those from nuts, seeds, and vegetables, include unsaturated fats that are easier for the body to process. One fat that O'Neill recommends for those with pancreatic or liver issues is coconut oil. Coconut oil is yet another type of saturated fat except that it is beneficial because the body has no trouble metabolizing it. Therefore, coconut oil does not include bile or pancreatic enzymes in the breakdown order and can therefore be gentler for patients with poor digestive health. So the introduction of unsaturated fatty acids, coconut oil, olive oil, avocado in the diet will help to improve the condition of not only the pancreas, but also the whole digestion system.
For processing nutrients properly, keeping blood sugar levels stable, and supporting your body's metabolism.
What particularly gets O'Neill's interest is the way caffeine affects the pancreas. Many people go through their day relying on coffee to help them fight off sleep, but it introduces another hormone, which is glucagon, that also comes from the pancreas. When we take caffeine, the body interprets that something is wrong, thus releasing glucagon to increase the blood sugar levels. While this reaction goes a long way in enhancing energy for a short while, it stresses out the pancreas in the process of normalizing blood sugar levels. The high and low blood sugar level swings over a period will eventually promote insulin resistance and further stress the pancreas. To assist the pancreas's normal functioning, O'Neill recommends reducing or completely eliminating caffeine for those suffering from diabetes or any other conditions concerning the pancreas. If you're liking the video so far, make sure to subscribe to the channel. Margarine is a common ingredient used in cooking and one of the foods that O'Neill advises against. Margarine is a substance that was originally a culinary analog of butter and has since fallen under the category of margarine spreads. This altercation makes it more complicated to get the fat into the pump since the chemical alteration affects the molecular structure of the fat. Substituting margarine whenever required leads to excessive margarine consumption, whereby when consumed, this compound can prevent the receptor sites on the cells which insulin relies on to perform its tasks. This means that it makes it difficult for the body to control the amount of sugar in the bloodstream, which plays a part in causing insulin resistance. O'Neill recommends olive oil or avocado when cooking instead of margarine or its substitutes, adding that those fats do not affect normal cell activity and the action of sugars and insulin.
They will increase the liver's ability to release its bile and also pancreas. So those three herbs do those three.
Apart from changing the diet, O'Neill points out that certain lifestyle choices are also necessary to improve the health of the pancreas. It is known that regular exercise is one of the most efficient measures of increasing the insulin sensitivity and protecting the pancreas. Physical activity makes it possible for the muscles to utilize glucose better, which lowers the amount of insulin that the pancreas is required to make. It therefore prevents insulin resistance and decreases the chances of an individual developing type 2 diabetes. Stress control and adequate sleep are the other issues that O'Neill addresses. Coming from either chronic stress or lack of sleep, it can impair metabolism in all and in its ability to handle glucose, resulting in increased blood sugar levels, which puts added strain on the pancreas. Thus, adopting proper stress management tools such as yoga, deep breathing, or meditation and adequate sleep will enable the body to control blood sugar and thus reduce the risk of pancreatic disorders. What do you think about this? Let us know in the comments section below and make sure to like the video. Thanks for watching.